Welcome to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. The district is the place to keep you updated, informed, and inspired regarding everything Fulton County District 4. This show is recognizing the National HIV Testing Day, World Sickle Cell Day, and the importance of blood donations. Immediately following this short break, we will have the special honor to hear from Mr. Joshua O'Neill, Director of Sexual Health Promotion for the Fulton County Board of Health. Don't go anywhere. We will be right back.
Hi, I'm Helen Barrow with Customer Service. If you are a senior in Fulton County and are in need of assistance, we are here to help. Please contact the Fulton County Senior Services Department at 404-613-6000 or visit the county's website at fultoncountyga.gov for more information and a list of available services.
Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. Joining us today is Mr. Joshua O'Neill. Joshua O'Neill is the Sexual Health Program Director for Fulton County Board of Health. In addition to overseeing sexual health, he has activated innovative strategies to improve healthcare experiences, increasing comfort and accessibility for people seeking HIV and STI screening. Joshua has more than 10 years of experience in public health and community-based clinical settings, working as a tireless advocate for queer and trans communities, people in the sex trade, and people who use substances. His professional and academic work related to condom fit, HIV testing technologies, sex positivity, and clinical best practices for LGBTQ communities have been published in the Journal of Clinical Virology, Journal of AIDS, and Springer Journal's Current HIV/AIDS Reports. A passionate educator, Joshua teaches human sexuality courses at the City College of San Francisco and presents and trains across both local and national stages. Joshua, how are you?
Hey, I'm great. Thank you for having me, and thank you for that introduction.
Well, Joshua, can you tell us about National HIV Testing Day and how Fulton County Board of Health is participating and getting the word out to Fulton County residents?
Absolutely. So National HIV Testing Day dates back to 1995 when antiretroviral treatment became available for folks living with HIV. It gave them an option to live a longer, healthier life with a chronic condition versus what people had been experiencing before, which was assumed to be more of a death sentence. And so with this new technology, with this medication, we had a different relationship with testing and wanting to get into communities so that we could ensure that they had access to these services and treatment so they could live long and healthy lives. This weekend, what National HIV Testing Day has turned into now, those of us have a different relationship with HIV, especially from younger generations where we don't see the impact and have experienced the impact. So we are out there recognizing that HIV is still a thing. We want to keep it on folks' radars. We want to really encourage people to know their status, to get tested on a regular basis, to know where to get tested and how to do so in a way that's convenient for them. So we are going to be out in community. On Friday, we're going to be at a mall crawl. So we're going to go to several different malls throughout Atlanta just to do some outreach and some education, providing some information. We're also doing a block party where we're supporting young, especially Black and Brown folks, queer and trans folks, and bringing folks together to celebrate our communities and also to deliver information and access to services in those spaces. And we're also doing events at the Underground Atlanta, which is close to our space here at 10 Park Place downtown, where we're going to be intercepting folks on the street and just letting them know that it's the official National HIV Testing Day, and to give them, again, information and access to services, hopefully so people can know their status.
Well, Joshua, you are serving the community in such an awesome way. How did COVID-19 impact HIV-related services and support?
That's a great question. So in many ways, COVID dismantled most HIV prevention and support programs in that people were not out and about, people were not accessing testing, people were not getting access to information and education. So the testing numbers went down considerably over the last year and 2 years, actually. And so we're trying to rebuild all of our programs. We're trying to get back out into community. We're trying to reconnect now that people are back into their social spaces and in community. But also, interestingly enough, COVID has allowed us to expand HIV testing, especially at home, for example, because people are used to testing on a regular basis. They're used to having conversations about vaccines, about partner notification, about home testing and biomedical intervention. So I think people are more open to testing, especially in the comforts of their own home than they were before.
And what communities are most impacted by HIV, and how is the Fulton County Board of Health prioritizing those communities?
Another good question. So across the board here in Atlanta in the South, we see just health disparities generally, and populations that experience COVID disparities are the same ones that are experiencing HIV disparities. So again, Black and Brown communities, people who are immigrants, folks that are gay, bisexual, transgender, as well as people who have a relationship with substances. So some of the ways that we're showing up is first and foremost at recruiting and employing folks from those communities to be a part of our team. We are expanding our programming to ensure that folks, regardless of their economic status, of their location, of their background and culture, have access to this information. So we're going to communities themselves instead of expecting for people to come to us. And we're also starting a drug user health initiative because many of us have relationships with substances, even if it's occasional alcohol use, and those substances impact decision-making and our relationships with others and, the exposure to HIV. So we're going to have frank and honest conversations about substances and the impacts of substances on our relationships and our well-being.
You said something that is so very important to me. I always say that we cannot sit in our offices in the air conditioning in the summertime and in the heat in the wintertime and expect for people to come to us.
Yep.
We need to go where the people are, get out into the neighborhoods, into the communities, and take the services to the street, basically. And so what you said was so important to me. So can you share some more important information as it relates to HIV prevention?
Sure. So, I mean, exactly what you're saying, which is we are out in community to give information in a way that is sex positive, that's honest, instead of policing people and trying to use fear-based messaging. It's really about meeting people where they're at, giving them an idea of what are the tools in order to eliminate transmission and letting them choose what works best for them. So that could be anything from, again, testing to access to services, to housing, to food resources. It can also be something along the lines of overdose reversal in communities where we're seeing a lot of overdose and death that is urgent. And when we provide these supplies and support to communities, they will engage with our services. Of course, condoms and other safer sex supplies are also available, but really just knowing your status and knowing how HIV is transmitted and how we as individuals will come across HIV in many types of different ways is the first start.
Well, Joshua O'Neill, thank you so much for taking time with us to share and talk about your work around the work of HIV prevention. It is very important for our communities. So let's take a break. And when we return, we will be joined by Ms. Tiffany Lawrence. She serves as the program manager at Fulton County's Department of HIV Elimination.
Hey, thank you.
Thank you.
That was perfect.
I see you mobbing over her. Let's go. Let's mob. Let's crawl. Let's crawl. Let's crawl. Hey, yo, we mobbing. Come on, girl. Let's crawl. Hey, yo, let's crawl. Hey, yo, let's crawl. Ay, let's crawl. Ay, yo, let's crawl. Boom.
Welcome back to the district. I'm your Fulton County Commissioner, Natalie Hall of District 4. If you're just joining us, we have the honor of having Ms. Tiffany Lawrence, Program Manager at Fulton County's Department for HIV Elimination. Tiffany Lawrence has a Master's of Public Health and is the Ending the HIV Epidemic Program Manager at Fulton County's Department for HIV Elimination. Ms. Lawrence manages the planning and operational activities for $3.9 million EHE program. She has evaluation and program management expertise of programs focusing on HIV prevention, care, and treatment, health profession workforce development, and substance abuse mental health infrastructure development. She is highly skilled in providing support to programs related to planning, design, implementation, measurement, and dissemination. Tiffany Lawrence received a Bachelor of Science degree in psychology from Georgia State University and a Master of Public Health degree with a concentration in health education, health promotion from Morehouse School of Medicine. Ms. Lawrence, thank you again for joining us.
Thank you so much for having me.
Could you explain to our viewers what the Department of HIV Elimination does?
Sure. So I think our department name says it all. HIV elimination. That's the goal that we're in pursuit of. So all of the programs that are within our department are in support of this goal, and we're focused on improving access to care, availability of services, and quality of care for persons living with HIV across a 20-county area in Metro Atlanta. So our counties that we serve reach as far north as Pickens County, as far south as Spalding County, and to the east and west out to Carroll County and Walton counties. So our department receives over $30 million annually for our Ryan White Part A program and our Ending the HIV Epidemic program. We use this funding to partner with organizations across Metro Atlanta that provide direct services to clients. And this year, we funded 25 organizations who provide core medical and support services to HIV clients and their families.
Well, you mentioned the Ryan White program and the Ending of the HIV Epidemic program. What are these programs and what is the difference between the two?
Okay, so our Ryan White Part A program provides health services to the majority of persons living with HIV in Metro Atlanta. We've been funded by the Health Resources and Services Administration since 1991 to provide these medical and support services to underserved clients that have been most severely affected by HIV. So these services are designed to support clients getting into HIV care and remaining in care so that they can ultimately reach viral suppression. And when we say viral suppression, we mean that the amount of virus in a client's blood is so low that the person can remain healthy. So the Ryan White program is an eligibility-based program, and clients must meet specific criteria in regards to income and residency to qualify for the program. So for instance, they must live in one of the 20 county areas that we serve, and they must have an income of up to 400% of the federal poverty level. Now, when we're talking about our EHE program, or Ending the HIV Epidemic, this program came along in 2020, and it's a national initiative that's aimed at a 75% reduction in new HIV cases by 2025, and at least a 90% reduction by 2030. So our EHE program focuses on 4 of the hardest hit counties in Metro Atlanta that have the highest rate of new HIV cases. And those counties are Fulton, Cobb, DeKalb, and Gwinnett counties. So we're excited about our EHE program because it allows us to build upon the services that are provided through our Ryan White Part A program by expanding core medical and support services. And it allows us to have more flexibility as it relates to the eligibility and opportunity to do some more innovative projects. So EHE doesn't have the income and residency restrictions such as the Part A program does. So as long as a client is HIV positive and accessing care in the 4 counties that I mentioned, they're eligible to receive EHE services. And if I could just mention some of our exciting things we're doing through EHE, we are funding organizations to provide extended hours of service outside of the traditional 9 to 5 hours. And clients can receive services between 8 a.m. to 8 p.m. and on weekends at many of our locations. We're all, sorry.
Go ahead, please.
Okay, I'm sorry, that is such a long answer.
No, that was an awesome answer. We need all the information we can get. You know, information is power, and everybody needs to know the outstanding services and programs that Fulton County has to offer, and especially in the HIV elimination department.
Okay, so I'm going to back up a little bit and then finish this answer for this. It's a little bit more to go.
Go ahead.
Okay, so through our EHE program, we fund organizations to provide extended hours of service outside of traditional 9 to 5 business hours. So clients can receive services between 8 a.m. and 8 p.m. and on weekends at most locations. So through EHE, we were also able to expand telehealth services. So clients were able to continue their care in the midst of the COVID-19 pandemic. We are also providing hormone replacement therapy for our transgender clients. Our agencies are implementing innovative interventions that link clients to care and find those that have dropped out of care to get them back into services. So really excited about this program. We're utilizing novel approaches to meet our community's needs, and we're reaching new populations and broader geographic areas that previously we didn't have access to. Such as drug users, those of Latin descent, and transient populations that have historically been labeled as hard to reach. So great things happening for both programs.
That is so awesome, Tiffany. I didn't know that you had that many. Those are just services I didn't know about. So I'm absolutely happy that you took the time to share that information with us. And so all of these great services, are there costs involved?
Okay, I'm so glad you asked that. So the beauty of our program is that our services are made for low-income individuals that may be wondering how they would even pay for care. So our services are free or low cost. You'll never be denied services because you cannot pay. So I think the takeaway for viewers should really be that your ability to pay should not keep you from getting the HIV care that you need.
That's awesome. Well, how can people find out more about your programs and about HIV services?
Sure. So you can find out more information about our programs in a few places. You can visit our website, www.ryanwhiteatl.org, to learn more about our programs and the services we offer. And you can learn how to become a member of our planning council there. You can also call our office directly at 404-612-8285. And if you're looking to learn more about HIV and hear real stories from real people living with HIV, then you should check out our Atlanta is Greater Than AIDS website, which is at www.greaterthan.org/Atlanta. And if you would lastly like to reach me directly, of course, you can always email me. My email address is tiffany.lawrence@fultoncountyga.gov.
Tiffany, what additional services do you have in your programs?
Okay, so the services that are available through our program are designed to provide comprehensive care to clients. So we have numerous services that are aimed to address the whole client's needs. And the services our programs offer are medical care, mental health and substance use services, oral health care, housing, case management, support groups, food and nutrition services, medical transportation, emergency financial assistance, health insurance navigation, legal services, and translation services to our non-English speaking clients. So all of the services that would just really help a client be able to get into care and be successful in participating in their healthcare.
Oh, those are awesome services, Tiffany. Thank you.
Thank you so much.
Well, Tiffany Lawrence, thank you for taking the time with us to share this amazing information and provide updates on how you're tackling HIV elimination. This has been a wealth of information for us. And when we return, we'll be right back and joined by Ms. Tabatha McGee, the new executive director of the Sickle Cell Foundation of Georgia. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. If you're just joining us, we have the honor of having Ms. Tabatha McGee, the new Executive Director of the Sickle Cell Foundation of Georgia. In her new role as Executive Director, Ms. McGee works directly in building star performers among staff while graciously attending to the needs of clients, community partners, and the Board of Directors and all our stakeholders. Tabitha possesses the intestinal fortitude to amplify the voices of those living with and affected by sickle cell disease. She takes the helm of the foundation as it enters a rigorous strategic planning process designed to elevate the foundation's offerings, expand the foundation's reach, and enhance the foundation's work. With a strong track record of success, she continues to maintain the operational strength of the organization to ensure the highest quality of its program delivery and advocacy efforts. Welcome to the show, Tabitha.
Thank you so much. How are you today?
Good, how are you?
Oh, well, thanks for asking.
And Tabitha, so tell us about the Sickle Cell Foundation of Georgia and what it's all about.
We're a 501c3 organization that was founded 50 years ago. We're in our 51st year now, in 1971, by the late Dr. McGee and Dr. King. Our mission is to engage, educate, and energize the community to improve the quality of life for people affected by sickle cell disease and trait. And we do that through our various programs and services.
Wow, well, tell everyone, what is sickle cell disease and how many people does it affect?
I'm glad that you asked that. Sickle cell disease is a chronic inherited red blood disorder. It's something like, you inherit from both of your parents, just like we inherit our eye color and the color of our hair. In the child, for a child to have sickle cell anemia, both the parents both has passed the sickle cell gene on to their child. It is not contagious, so they can't catch it. A lot of people think you can catch it, but you can't. And sickle cell disease is very painful. And so our normal hemoglobin is round, squishy, and it gets through our veins without any problems. But hence, when the individual has sickle cell disease, their red blood cells sickle, just like a half moon, crescent shaped. And so it's very hard to get through the arteries, which causes a major crisis. And so it's a very painful disease. Altogether in the US, it's about 100,000 individuals living with sickle cell disease. Although it's predominantly African Americans that are impacted by sickle cell disease, we also have other races as well. In Georgia, we have 14,000 individuals living with sickle cell in sickle cell disease, and we're the fourth state in the US with the highest number of individuals with sickle cell disease. Sickle cell disease is chronic, it's inherited, it's painful, and so we want to, just continue to create awareness for sickle cell disease.
Well, you recently brought awareness to sickle cell disease on World Sickle Cell Day in June. Tell us more about that.
Well, I honestly can't take credit for it, but I just want to tell you about it. We have an amazing communications director, and he had the knowledge that our buildings could be lit up red in honor of World Sickle Cell Day. So he sent letters, he made phone calls, he requested different organizations to join us in bringing awareness. We got one building to say yes. We had another company, they said yes. So altogether, it was 10 companies that came together, said yes. Most notably, the Mercedes-Benz Stadium, the Kings and Queens building, the Atlanta City Hall, the Hartsfield-Jackson Atlanta International Airport. We have 101 Marietta, 1180 Peachtree, Georgia's own credit union, Georgia's International Plaza, as well as 1105 West Peachtree. And we know that next year we'll have even more.
That is outstanding. So now how are you going to outdo that? And how will you celebrate or illuminate Sickle Cell Awareness Month in September?
So he's right now sending out more letters, and they've already requested for the first 10. So they will be lit on September the 12th. But yet he's trying to have other organizations join as well. And now, because everybody's seeing that it could be done, we have other sickle cell community organizations that are joining in, spreading the word. So it's going like wildfire. So I can imagine that on September the 12th, we'll have even more individuals that show up at the buildings taking pictures in honor of this a big moment for us. And
I'm looking forward.
I'm sorry.
I'm looking forward to seeing that.
Well, thank you. And then inside of September as well for Sickle Cell Awareness Month, we have Meet the Executive Director, because as you noted, I am new here. I'm not new at the foundation, though. I've been here for 7 years. I was promoted or appointed to my position on October the 1 by the Board of Directors. So this year on September the 1st, we have Meet the Director. That's going to be a Zoom call. We have individuals that want to come online. They'll be able to ask me questions, understand what sickle cell disease is, understanding, what programs we're offering. And then on September the 8th, we have the Sickle Cell Candlelight Vigil that we're doing to honor those that we've lost to the battle with sickle cell disease. And my Lord, with COVID being on the horizon, we did lose quite a few sickle cell warriors. On September the 10th, we have our 42nd Sickle Cell Road Race Walk. And that walk is a fundraiser that we use to raise funds for children going to our sickle cell camp. And so we sent about 150 children to the sickle cell camp. And so this walk raised funds for that camp. And last but not least, I know it's not in September, but we do have our very first annual Black Tie Gala that we have a fundraiser for at the end of the year. So we're really excited about our programs.
Well, I'm excited too. I didn't know that Sickle Cell Awareness Month would encompass so much greatness, and I hope I can come to that gala.
Absolutely. And we would love for you to come to our open house as well. We're having an open house. I think, Maria, you said September the 4th, 5th. She's still working out the details. She's here with me now. So we will have an open house because we've completely renovated our building. It's a 13,400 square feet building. We've totally renovated all new floors, new paint, new furniture, new awnings. I mean, everything is brand new. It looks so good here. And, so COVID was a bad thing, but it was a good thing for us because we were able to send the employees home to work remotely. I had a blank canvas, and so I was able to renovate the whole building, very in a very short period of time, so that now when our sickle cell warriors are coming for services, they got a brand new building. It smells good. It looks good. We have fresh flowers all over the place every day. So I absolutely am so excited about what our sickle cell warriors are going to see and what they're going to feel when they come to our September Awareness Month kickoff and our open house.
Well, thank you. And thank you to your sickle cell warriors. And thanks for coming on the show and taking the time to update us on how you're tackling sickle cell disease in Atlanta, Georgia.
Thank you so much, Commissioner. It was such a pleasure to meet you. Thank you for the invitation. I truly appreciate the time here today.
When we return, we will be joined by Ms. Terri Badour, the Executive Director of the American Red Cross. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. If you are just joining us, we have the honor of having Ms. Terri Badour, the Executive Director of the American Red Cross, on today's show. Terri Badour is the Executive Director of the American Red Cross of Georgia, serving Greater Atlanta, where she engages the Board of Directors and community volunteer leaders and expands external relations and strategic partnerships. Prior to this, she served 7 years as both the Chief Executive Officer of the American Red Cross of Georgia and the Executive Director of the Metropolitan Atlanta Chapter. Terri was named to Atlanta's magazine Atlanta 500 Most Powerful Leaders in 2022, 2021, 2020, and 2019. She was selected by the Atlanta Business Chronicle as a 2019 Woman Who Mean Business honoree. She was inducted into the 2012 YWCA of Atlanta Academy of Women Achievers in recognition of her professional and civic endeavors, and received the Junior League of Atlanta's Iselene Campbell Founders Award. Terri is a Michigan native, holds a Bachelor of Science degree from Western Michigan University. She holds a Master's of Science degree from Florida State University and completed her graduate internship with Centers for Disease Control and Prevention. She is active in the Mount Vernon School community and lives with her family in Dunwoody, Georgia. Welcome to the show, Terri. How are you?
I'm good. Thank you so much. It's great to be here and great to see you.
It is great to have you on the show to tell us more about blood donations and what is the importance of blood donations and who benefits from the blood donations.
Yeah, thank you for asking that. So, the mission of the American Red Cross is to really alleviate human suffering in the face of emergencies. And we do that by mobilizing the power of our volunteers and the generosity of our donors. And for us, donors are both financial donors and blood donors. So every 2 seconds, someone in the United States needs a blood transfusion. And that could be individuals experiencing childbirth complications, people fighting cancer, trauma patients in emergency rooms, and individuals who are living with sickle cell disease. But only about an estimated 38% of the US population is eligible to donate. And only about 3% of those age eligible people actually do donate each year. So every day we try to get out and inspire individuals to roll up their sleeve and donate blood.
Well, earlier in the show, we heard from Ms. McGee, the Executive Director of the Sickle Cell Foundation. And why did the Red Cross launch its Sickle initiative?
Well, we launched our national initiative around sickle cell so we could help grow the number of blood donors who are Black, to help patients who are living with sickle cell disease, and to try to help improve their health outcomes. We heard from Tabatha about the number of individuals, 100,000 people who live with this, and the majority of those are of African descent. And while a lot of people think about blood donations around blood type, A or B or O, we have found that blood donations from individuals of the same race or a similar ethnicity and blood type have a unique ability to help patients who are experiencing a sickle cell crisis. And we believe that individuals living with sickle cell should have access to the best compatible blood type and to reduce the complications they have. So we decided we wanted to launch an initiative to increase awareness and really address this health disparity that is in our community.
And how do blood transfusions help individuals living with sickle cell?
Well, we heard from Tabatha that, sickle cell disease distorts the shape of red blood cells. And so individuals can require frequent transfusions throughout their lifetime to treat the complications. But unfortunately, the frequent transfusions can make finding compatible blood types more difficult because the patients can actually develop an immune response from against the blood from donors that's not closely matched to the blood of the recipient. And so it's critical they receive blood from a donor with that same racial or ethnic background to help avoid those serious complications. And we've work very closely with the Sickle Cell Foundation. It's a wonderful partnership that we have. And really, they're individuals that are living with this, make great ambassadors to share with the community. This is what they experience. And that helps inspire individuals to say, you know what, I could make a difference. I want to give blood. I want to help someone.
So you spoke about how people can help, but what else can they do, or what else do they need to know about donating blood?
Well, you know, we obviously need individuals who actually want to roll up their sleeve and donate, but we really do our blood drives with organizations. So partnerships are incredibly important, whether it's a faith-based partnership, a school, a company, government, even Fulton County government is a blood drive partner of ours, and we're very, very grateful for that. So we ask folks, you can take action if you visit our website. You can go to redcrossblood.org or redcrossblood.org, and you can find out how to become an individual donor. You can look up a blood drive by zip code, or you can learn how to become a host of a blood drive. We also have a blood donor app, and folks can download and use that, or you can even call 1-800-RED-CROSS and find out how you can help. And we encourage everybody. Blood donation is a simple process. You don't need to know what your actual blood type is to make a donation appointment. And so we just ask folks, you know, please think about, you know, that life that you could save, and roll up your sleeve and help a fellow member of our community by donating blood.
Well, thank you so much, Terri Badour, for sharing this important information with us and talking about what you're doing and educating the community on the importance of blood donations. This information has been very good. Thank you so much.
Thank you. We appreciate the opportunity to share and encourage all the residents in the district to visit redcrossblood.org or call 1-800-RED-CROSS. We would love to see them at an upcoming blood drive. Thank you, Commissioner.
Let's take a break, and when we return, I will give my final thoughts.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. It was a pleasure to have Mr. Joshua O'Neill, Director of Sexual Health Promotion, Ms. Tiffany Lawrence, Program Manager from Fulton County Department of HIV Elimination, Ms. Tabatha McGee, Executive Director of Sickle Cell Foundation of Georgia, and Ms. Terri Badour, Executive Director of American Red Cross. These individuals are dedicating their lives to address the issues that not only affect Fulton County, but our world. I'm happy that each of them took the time out of their day to come and give updates on current information around the areas of HIV elimination, sickle cell, and the importance of blood donations. Fulton County government will continue to keep you updated via our website at fultoncountyga.gov as it relates to the COVID pandemic, testing, masks, and vaccinations. And please continue to follow CDC guidelines and have a discussion with your medical provider regarding any other precautions that you should take. And please follow me on Facebook, Instagram, and Twitter at FulcoD4. That's FULCOD4. COD and the number 4. That's our show for today. I'm your Fulton County Commissioner of District 4, Natalie Hall, and thanks for watching the district.